Hello and welcome to Cancers 101. I'm Rittika, and today we are peeling back another critical layer of cancer care. How weakened immunity turns the body into a playground for multiple infections. Cancer is already an uphill climb, but imagine trying to summit that mountain while being pelted by viruses, bacteria, and fungi all at once. This is the reality for many cancer patients. And joining me to unpack this tangled web is Aditi. Aditi, this issue is more common than just most realize, right?
Absolutely. When cancer or its treatment suppresses the immune system, like in leukemia, lymphoma, or chemotherapy for solid tumors, the body loses its natural defenses. This opens the door to polymicrobial infections, where viruses, bacteria, and fungi invade simultaneously or in sequence. It's not just one enemy, it's a coordinated attack.
It's like your immune army goes on strike. The gates are unguarded, the invaders don't come one by one, they storm in as a mob. Let's talk about how these microbes actually get in. One big reason, mucosal barrier breakdown. Whether it's radiation burn in the throat, ulcers in the GI tract, or tumor invasion into tissues. Cancer patients often have physical breaches in their body's natural shields.
Right. These breaches are like holes in a castle wall. Once they are there, organisms that are normally harmless or even part of our normal flora can enter the bloodstream, lungs, or other organs and trigger infections. And because the immune system is already compromised, it can't contain the spread. We often see combinations like Candida with E. coli in the gut, CMV reactivation plus Pseudomonas in the lungs, or MRSA alongside Aspergillus in ICU patients.
Let me share a real world example then. A 60-year-old woman with metastatic breast cancer was undergoing radiation to her chest wall. 2 weeks in, she developed fever, shortness of breath, and a painful mouth sore. Blood cultures grew Klebsiella, and imaging revealed a fungal lung lesion later confirmed to be Aspergillus fumigatus.
This is a classic polymicrobial pneumonia, likely triggered by radiation-induced mucosal damage and neutropenia from chemotherapy. Her treatment had to be paused, and she needed broad-spectrum antibiotics, antifungals, and GCSF to recover.
This case reminds us when the immune system crumbles, infections don't wait in line, they pile on. So, how do we protect these fragile patients? It takes more than just antibiotics, it takes a team effort.
Exactly. Here is what the multidisciplinary approach looks like. Early diagnostics, using PCR panels and fungal biomarkers to catch infections before symptoms explode. Second one, tailored antimicrobial therapy, not just broad spectrum, but personalized based on the most likely pathogens. Here comes the next, mucosal care, like oral rinses and GI protectants to preserve barrier integrity. Last, immunomodulation, using colony stimulating factors and in select cases, checkpoint inhibitors or IL-7 to boost host defenses.
And of course, infection controls protocols, from hand hygiene to HEPA filters in transplant units, form the invisible armor around every patient. So here's the takeaway. Cancer doesn't just kill through cell multiplying, it weakens the fortress from within. And that's when polymicrobial infections march in.
These infections aren't side effects, they are co-conspirators in cancer-related deaths, and tackling them requires vigilance, science, and coordinated care.
In the end, it's not about fighting microbes or tumors alone. It's about understanding how they interact in compromised host. The battlefield is complex, but every small strategy helps strengthen the line of defense. That's all for the episode of Cancers 101. If this sparked your curiosity, don't forget to follow and share. We are here every week breaking down cancer science one story at a time.
Thanks for tuning in, and we'll see you in the next episode.